Welcome, everyone. Welcome to the Youth Special Interest Group of the CTN. And I'm delighted to have the chance to introduce our speaker today. Thank you, Meredith, for joining. Dr. Meredith Gansner is in a new role, just very recently transitioned to a role of attending psychiatrist at Boston Children's Hospital in the Department of Psychiatry and Behavioral Sciences. And she's also an instructor of psychiatry at Harvard Medical School. And previously, until her transition to Boston Children's, she was a child psychiatrist at Cambridge HealthAlliance. And she's an MD from Rutgers, and she also did a psychiatry residency at Harvard and the Longwood psychiatry training program. And then she's also done a fellowship in Child and Adolescent Psychiatry at Cambridge HealthAlliance. And I've gotten to know Meredith's work in the last, I guess, maybe year and a half to 2 years, and in terms of her research interest. And I think is so innovative and important, and we'll hear about it today. She's been focusing a lot on using digital phenotyping, which I'm sure she'll talk about what that means, to look at issues of problematic internet use among kids, among adolescents, and that the relationship of that to sort of like the relationship between their digital health habits and their substance use. And she's been doing all kinds of interesting work in this regard, has all kinds of great ideas of where this line of research could go. And today she's here to share with us some of her work to date in this area. It's a really pioneering space, the application of digital phenotyping in this way to adolescents. So we're excited to hear, Meredith, about your latest work. Thank you so much for joining the Special Interest Group. We'll turn it over to you.
Awesome. Thank you so much, Lisa, for having me and for your guidance and support over the last year and a half, and trying to sort of shift my research interests and concentrating primarily at first on problematic internet use, and now shifting a little bit more towards problematic ways of using the internet as that relates to substance use habits. So just if I could get it's always embarrassing when I do technology talks and can't get the slides to move. Okay, so doing a brief outline of the talk, I'm going to talk why we should be interested in the relationship between adolescent digital media use and substance use. So why should we care about how digital media use can potentially influence substance use? Then I'm going to talk about the challenges in understanding that relationship using traditional research methodologies, and then talk, as Lisa mentioned, about digital phenotyping and its potential role in clarifying that relationship between digital media use and substance use. Just a spoiler alert, and I think also was a little bit alluded to at the beginning, some of this work that I'm going to be talking about is studies that I've published previously, but I actually haven't done a study yet using digital phenotyping to clarify this relationship. And I'm hoping to, and I have a grant proposal in to do so. But I guess unfortunate for some of you who may have been like, man, I was really hoping to get the answer today. It's TBD. So just giving you that frame of reference. So background, as many of you, I'm sure, know, adolescent overdose deaths are rising. And what's really notable is that rate of drug use in adolescents hasn't increased, but when adolescents are using substances, their chances of dying are higher. So I think the recent estimate was that maybe 80,000, 85,000 life years have been lost due to teens that have died prematurely due to drug overdoses. And as you also probably know, as to why that is happening, counterfeit pills are thought to blame. Specifically, really, fentanyl, the drug fentanyl, right, is a potent opioid that unfortunately has been very easy to make and cheap, and has been infiltrating drug supply, not only of opioids, but also of substances that really should be completely devoid of opioids. So we've been seeing teenagers that they're looking to get Adderall or Xanax or another prescription medication that they assume is in fact that medication, and ends up being laced with fentanyl, and youth that are not using opioids daily such that they have tolerance are unfortunately dying of overdoses. And so that these cases are just increasing as time goes on. I'm sure a lot of you have seen headlines related to that. And the bottom line, I think this really poignant quote highlights it. We're watching a tragedy unfold, and it's time that we stop watching it and start trying to stop it. So how do we stop that? Well, I think in order to really stop anything or prevent anything, right, and especially in public health and medicine, we have to understand that relationship. And I won't go to so far as to say anything other than the fentanyl is really the cause of death, right? Like the overdose deaths are, in fact, they're definitely most due to fentanyl and these counterfeit pills. But we also know that with adolescent substance use in general and disorders, there are a lot of factors that play into why youth or young adults may choose to use substances or purchase a substance, right? So there's peer influence, there is school and other kind of systemic organizations that may kind of support youth and influence whether or not they engage in substance use. There's the family unit, and there's genetics, and all these things combined can play a potential role in an adolescent choosing to use substances and then developing a subsequent substance use disorder. But what I think is really notable about the recent spate of overdoses is that a lot of these youth don't actually have a substance use history, at least that has been known by parents. And I think on the one hand, this is probably due in part to the fact that a lot of youth were kind of maybe using substances, these procuring substances that they thought were prescription pills, that they weren't actually being prescribed, sort of off the radar of the parents for some time, right? And using them kind of more socially, or maybe just kind of in the middle of the week procuring a pill, right? But I not to show my age too much, I remember kind of back in the day, back when I was in high school, there's a lot of discussion of youth going to kind of pill parties where they would go into their parents' medicine chest and they would get all the prescription pills and they'd combine them and kind of, try them out, see what happened, that sort of thing. And, we're seeing that from these stories, these horrific stories of teens dying, this isn't exactly like that. These are teens that sometimes are, just they have no history of substance use. There was no big party going on. They thought that they were getting Adderall or thought they were just getting Xanax or oxycodone and just looking for, one pill of it. And then unfortunately died because of the pill being laced with fentanyl. So I'm really curious as to what the contributing factors are related to, this type of use, these types of substance use events. And are there contributing factors that we really haven't been looking at yet? And that's an incredible leading question, right? Because obviously, you saw the title of the talk. I'm really interested in the factor of digital media use and how that pertains to these substance use events. Quick water break. And, again, if any of you have seen teenagers, this shouldn't be a surprise. For teenagers in the last decade. Teenagers spend the equivalent of more than 40 full days a year looking at their mobile phones. And I think if we have been considering the influence of peer relationships because teens spend so much time with their peers, we should also be considering the influence of digital media because they spend so much time with digital media. Recent estimates suggest that they might spend up to 9 hours a day on their screens. 50% say that they think they use their screens continuously throughout the day, and that includes overnight, so that they'll be talking on their phones and communicating on their phones at nighttime. So this is a huge potential influence on the lives of teenagers, and that includes their potential use of substances. So I'm sort of proposing a kind of trifold model of the ways in which digital media can influence substance use events in teens, both in terms of being a potential source of emotional stress that can lead a youth to decide to engage in substance use or procure a substance, also as a way that teenagers can be exposed to drug-related content online. And then lastly, and I think most recently, social media as a way to access and procure substances in a way that is different from before. I think all these factors combined, right, can lead to substance use events. So looking at each of those factors in a little bit more granularity, emotional stress is really, really tough for adolescents right now. We know that there is a national emergency in child mental health. This was sort of officially announced in 2021. I can tell you that as someone that was doing inpatient psychiatry in the end of, through the early pandemic and then through 2021, yeah, it's going on. It's still going on now in the emergency rooms. We're already, almost at capacity in terms of kids boarding for beds. This is a really serious issue that continues. And unfortunately, in the wake of the last several years, teenagers didn't have access to the coping skills that they had previously had, in large part because, access to friends was cut off because of the pandemic. Access to extracurriculars was cut off. Access to school, which, for some kids is a huge stressor, but for some, it's the only way they have access to their friends, all cut off. And so a lot of youth turned to digital media as a coping skill. And it was already something that we had long known was a coping skill for many teenagers in terms of managing uncomfortable emotions like anxiety or depression. Great. That's great that they feel better using the internet, right? But the internet can also be an incredibly stressful place for youth. There have certainly been many studies that have connected excessive time spent online and hours spent online with increased risk of depression or anxiety or other mental health outcomes. And I think I guess it's a kind of crudely made diagram, but it sort of depicts this vicious cycle that a lot of teenagers fall into in relating to the digital media use and their use of digital media as a coping skill and as their primary coping skill. So you have youth that may be experiencing, as you can see on the left, negative emotions. They turn to their devices to try and hopefully modulate those emotions and feel better. Unfortunately, they may feel better for a little bit, but then they can also be exposed to a significant amount of stress, cyberbullying, other negative events online, and then not really having other access to coping skills that they could use instead, then they turn back to digital media use and the cycle repeats itself. And there's so many ways that, unfortunately, young adults, adolescents, even adults can experience negative outcomes online. There is cyberbullying, there is extortion, there is, unfortunately, the picture in the frame here, catfishing, that's what it's, I couldn't read the words. There's FOMO, right? So that's not even direct bullying, but just the experience of seeing your friends all hanging out and doing things without you. There's vicarious discrimination, right? So seeing discrimination related to sexuality, gender identity, race, ethnicity, all of the above, and seeing that online and experiencing negative reactions related to that. And then there's, direct discrimination like online racism. So lots of different ways that teenagers have been documented experiencing negative outcomes online. And we do know that these adverse digital experiences do connect to the risk of substance use. Those youth that experience these adverse digital events, they are more likely to use substances. And online racism specifically is a well-established link. It is well known that social media racial discrimination is likely connected to an increased risk of using substances. And as a brief side note, I have an ALACRITY pilot grant, which is also looking kind of specifically at the role of exposure to online racism and its mediating role in terms of how being exposed to drug-related content and online racism can then lead to subsequent substance use and procurement. And I admit, this is like very, very fresh data. We just finished up data collection for a survey of 520 youth using REDCap. We finished it maybe like a week and a half ago. There was some drama with Facebook advertising that sort of forestalled everything, but we were able to finally get the surveys. And I've just kind of started processing the data and analyzing it, and found that at least preliminarily, high-risk substance use and experience of online discrimination were significantly linked with an effect size of 0.8. And I mean, I want to point out that this study specifically was looking at not just whether or not a youth engaged in substance use, but the severity of their substance use, right? We were asking also about high-risk substance use via a DASDE scale, and the two were definitely linked. And then we have one of the other circles of exposure to drug-related content. So I'm always surprised that there's not more literature about specific digital media exposures to drug-related content whenever I kind of go back and revisit the literature, simply because, right, social media and digital media, it's so varied and kind of all the different ways and all the different experiences one can have online. And it's so unregulated, right? So like normal media, like TV and news media, there's a lot more ability to restrict put barriers on the content and who has access to that content potentially. Granted, there are always ways to get around these things. But social media, it changes so fast and it's so much harder to regulate. And we know that teens and young adults are definitely seeing content related to substance use. This study looked specifically at marijuana use and exposure to marijuana advertisements and found that, unsurprisingly, right, marijuana advertisement exposure was related to higher odds of marijuana use. Another study looked at kind of getting high for likes, the concept that people could post videos of themselves on TikTok getting high as a way to generate likes and attention, and sort of noting that none of these videos that portrayed cannabis use in this manner were actually age restricted. So, ostensibly a bunch of adolescents could be watching these videos, and with a prefrontal cortex that isn't quite firing on all cylinders yet, they're thinking like, oh, this is a way to get attention, a way to get likes, a way to get people to know who I am. And you can easily see how they could kind of fall into that trap, engaging in that sort of behavior online. And I also earlier this year did a study to get some preliminary data for my K-23 grant that I'll be talking about a little bit later in this talk, where we surveyed 400 youth nationally, also through REDCap, to get a little bit more information about exposure to drug-related content and specifically what that looked like. And in terms of just overall exposure rate, 78% of the youth that we surveyed said that they had exposure to drug-related content. And then of those youth that reported exposures, there you go, 66%, the majority of those exposures were unintentional. So 34%, assuming I'm doing the math right, of those exposures were kids that were intentionally like, I am definitely looking for drug-related content online. Like they were looking for those videos and unabashedly telling us that they were doing so. But the vast majority of the kids who reported exposures weren't actually looking for drug-related content, but reporting that they were seeing it. And in contrast to some of the prior literature, we tried to parse out a little bit more exactly those unintentional versus intentional exposures and see really which exposures seem to matter the most in terms of substance use severity. And unsurprisingly, you can see, all right, those kids that were like, again, intentionally looking for marijuana videos, intentionally looking for drug-related videos, did have much higher rates of substance use severity. But the unintentional exposure also appeared to be relevant compared to kids that had no exposure to drug-related content online. Those that had unintended exposures to drug-related content still had significantly higher rates of substance use severity. And then looking at types of unintentional exposure, kind of harkening back to the very beginning when I was talking about peer influence and substance use, it's really just, peer, and again, this isn't like necessarily friend peer, but just kind of online peer, people, social media friends, just having exposure to that kind of content seems to be the factor that really increases the risk the most. So there wasn't really any difference in substance use severity between those that had unintended exposures to like advertisements or just happened to see, drug-related videos online, not through social media, but those that actually had, peers posting content either related to their own personal drug use or just drug use in general, that appeared to be the really significant exposure in terms of increasing risk of substance use severity. And then lastly, access. So the New York Times posted an article really very determinedly blaming social media platforms for the rise in overdose deaths, saying that these tainted pills that youth are purchasing on social media is what is causing these rise in overdose deaths, because those pills that they're purchasing are the ones that are tainted and laced with fentanyl. And there does appear to be some research in general about how over time, social media platforms are in fact becoming increasingly used to purchase substances. This study looked specifically at the use of Instagram to purchase Adderall or other stimulants, so cognitive enhancing drugs. They refer to them as study drugs, SDs. So that's becoming now a very popular way to obtain stimulants. And then this other study looked at just overall the use of digital media and social media platforms specifically to purchase drugs. And they concluded that the social media supply through friends was the typically preferred method. And there was some, in retrospect now, right degree of wariness towards app-mediated supply. Apps were fast becoming a viable option for accessing drugs. And I think that it's just really important to reflect on the date of the study, which was 2019, because that was before the pandemic, and social supply very much probably dried up during the pandemic. And I'd be very curious to see kind of the resulting study that looks more at the landscape now in terms of social media procurement of substances compared to 2019, because I think that would probably be a very interesting shift. I can speak anecdotally that when I did outpatient psychiatry before my current job here, my patients were in fact using social media apps to procure substances. So what does this relationship look like, more than just the Venn diagram? I'm proposing it looks a little bit something like this. You have a kid that's experiencing depression, anxiety, wants to alleviate those symptoms, goes online, uses the internet to relieve those symptoms. There are going to be those kids that are exposed to drug and alcohol related content online, and that for them may look exciting and fun enough to say like, hey, I'm going to go procure substances so I can make a video of me getting high online and put it on TikTok. Then there's going to be another group of kids that will maybe experience negative events online, whether that's racism, and may say like, this is horrible. I feel terrible. I feel worse than I did when I first went on the internet. And that might lead them to seek out substances and use them accordingly. And then there's probably potentially a third group of kids that may go online, experience victimization, experience cyberbullying, may just not even experiencing that, just talk about how they're feeling pretty terrible when they go online, right? Turning to others for support, and express that negative affect online, and then have others then tell them like, hey, I have something that could make you feel better, or I've got this pill, like, do you want to try it out? Let's see what happens. So I think regardless of kind of which path leads you to the substance use and procurement, this potential relationship, actually, I don't know that it's potential anymore. We know that there's a relationship between, social media apps and digital media use, and then subsequent procurement of substances. And that unfortunate time in terms of procurement is greatly shortened, right? Right at your fingertips, you can experience something negative and get that exposure to drug and alcohol related content online, have somebody tell you, hey, I have something to make you feel better. And you can just go online, switch to another screen and buy a substance and buy a drug. And as one of my patients said, she had it delivered right to her door. And then her mom opened the door and there was fallout. But it's just a really critical relationship for us to understand the nuances of, because that can then help us to figure out what's happening, that kids are immediately turning to substance procurement online after going online and digital media. So how can we test this model? So there's always the old-fashioned surveys. As you saw in some of the data that I presented, I've definitely done cross-sectional surveys to get some preliminary data, but we also know that cross-sectional surveys really fail to capture the real-time relationships between digital experiences and substance use. I think that can be seen most predominantly in our understanding of the relationship between digital media use itself and symptoms of anxiety and depression, right? There's been a lot of research, a lot of it cross-sectional, saying that the more someone uses uses digital media, the more depressed and anxious they are, right? But everyone kind of knows correlation, and so we know that relationship is probably much more complicated, and I'll talk a little bit more about that in a few slides. My own research. There's also ecological momentary assessment, which essentially is sort of surveys on steroids. This is the use of longitudinal data collection so that you can kind of have patients report on their symptoms and behaviors as close in time to the actual events that you're trying to capture as possible. And then also ideally in the participant's natural environment. And so while, back a long time ago, this could be done through pencil and paper, now we have apps that can do this. And that's pretty cool because, kids could be on their phone. They get a prompt that says, hey, fill out the survey. And, ideally, it's going to eliminate some of that recall bias because, they're in the moment, they're experiencing something online, or they've just experienced something online, and they can give you feedback about, what happened in relation to that, such that they're not trying to be like, did I or did I not get cyberbullied 3 weeks ago, right? That's much harder to figure out. But ecological momentary assessment still has challenges. Adherence to a longitudinal protocol is challenging for anybody. It's also really hard for teens to fill out something every day, even with prompts. And, you start off really excited on day 1, and then by like day 15, you're a disgruntled cat. You're just like, I don't want to do this anymore. This is too many surveys. I don't want to. So in my own experience in doing these studies, I've definitely seen over time, adherence does fall off. And we also know that teenagers really aren't that great at recalling media habits. It's hard because they're doing it almost continuously. And so asking them to reflect on about how much they might be using of a certain app or how much time they're spending on a certain app, that's really hard for someone to approximate when they're always using it. So without providing some objective data or getting objective data on that, it can be tricky to know if the information you're getting from the teenagers is in fact accurate. So that leads me to, after this really long talk, talking about digital phenotyping. So what is digital phenotyping? Basically, it's the idea that you can do EMA, but also with the benefit of getting data from smartphones and personal devices that is usually sensor-based and passively reported. So you have active data as one component, which again are these surveys, videos. It can really be anything that a participant provides for you or does kind of for you and has to engage themselves in. And then the passive data, which is something that is collected without the participant having to do anything at all other than set up an app on their phone. And you can collect a lot of different things with passive data. There's GPS location, there's mobility data through the accelerometer, there's power state data, which gives you a sense of about how much someone's using their phone and how active they are on their phone. There's sleep metrics and actigraphy data. Those are just some examples of passive sensor-based data collection that have been done in other studies. And as I mentioned a little bit in the beginning, and as Dr. Marsh mentioned, I have been using smartphones to try to understand problematic internet use for really the bulk of my research career up to this point. That's kind of where I started. And problematic internet use really can be kind of defined as an individual's sort of inability to separate from their internet use and feeling as though they're spending kind of excessive amounts of time on it. And I first used app-based ecological momentary assessment to kind of capture relationship between an adolescent's sort of subjective experience of problematic internet use and their mood symptoms. So we were able to kind of day by day kind of capture the relationship between those. And while we did replicate that overall kids that had higher scores on depression and anxiety scales also, in fact, endorsed more symptoms of problematic internet use, we also found that in the short term anyways, when individuals engaged more with their phones and reported periods where they were more sort of dependent on or feeling that they were dependent on their phone use or needing to be on their phones, they actually, following those periods of time, had significantly decreased anxiety than they did before that they were engaging more with their devices. And so I recognized that was still very much dependent on subjective data collected from teens. So to try to add a little bit more objective data into it, I then started asking kids about their digital media habits, as well as their mental health, their depression, their anxiety, their symptoms of problematic internet use, and also asking them to provide me with their screen time, Apple screen time report. Most of my patients had iPhones. And we were able to look at mental health symptoms and problematic internet use symptoms both before and after the pandemic, as well as their digital media use, and found that problematic internet use did increase during the pandemic, or kind of, I know the pandemic's still going on, I recognize that, but in this case, it was, from the before in 2019 and then in 2020. And we also found that social media use as well significantly increased time spent on social media use. And again, it was great that we were able to get this data through the screen time reports rather than relying on kids to just estimate whether or not their social media use had in fact increased. And then finally, kind of upping, hopefully to up the ante a little bit more with digital phenotyping and getting some increasingly granular passive data. We then were able to use the app MindLamp, which is a free research app. We were able to get passive data looking specifically at how the phones were being used and how that related to some feelings of anxiety, depression, and problematic internet use. And as you can see here, I know it's a big table, so I'll just kind of spell it out, but we sort of found what we had replicated a little bit in the first study, although not with anxiety, but with depression, finding that the more engaged youth were on their phones, like when they were checking their phones more often, the number of phone sessions they had per day, they actually had less symptoms of depression. Their depression improved the more that they were engaged on their phones. And also they reported that their feelings of excessive internet use and needing to be on their phones also got better when they were on their phones, which is sort of not that surprising, right? Like if you're using something, you're not going to feel like you really are missing it as much. And that's essentially what happened. And so we were sort of proposing this model of, when kids don't have their smartphone access and the phone checks and sessions, they go down, they're likely kind of a worsening of depression and feelings of needing to return to internet use. A lot of these kids that I was interviewing for this and having participated in the study were in mental health treatment already, had existing diagnoses of depression and anxiety, were likely using their phones in order to alleviate those symptoms. And I also mentioned here, but didn't have in the table, is that we also saw an increase in circadian routine, which is basically how variable a kid's life is. How much are they engaging in activities like in a different way on a day-to-day basis versus how predictable is their life. And basically, the higher your circadian routine, the more predictable your life is. Basically, like you wake up, you go to school, you come home. That's it. And so we also found that the more that intensely they were reporting symptoms of wanting to engage with their phones and engage in internet use, they also had increasing amounts of wanting a static life, sort of static days where they were just like sitting at home, not doing as much, as evidenced through circadian routine through the passive data collection. So that's sort of I think it's almost all of the stuff that I've done related to these topics up to this point. So what are the next steps? So as I mentioned, K23 proposal is in, and hopefully it was going to be reviewed in October. That's the current plan. And it's proposing the use of an app called EARS, which is a digital phenotyping app, which has been used in this study and other studies, which is a fantastic app that allows you to collect a lot of sensor-based data that quite honestly is pretty difficult to collect using other metrics. And we're proposing using a 90-day digital phenotyping protocol to look at youth who have some experience with substance use within the last 3 months, not daily use, because then we wouldn't be able to really capture substance use events because there would be one every single day. And the kids ideally would be between ages 15 and 18, and they would fill out active surveys on the EARS app related to their exposure to drug and alcohol related content, online victimization, substance use and substance procurement, as well as symptoms related to their anxiety and depression on a weekly basis. And then EARS app will allow us to, without having to rely on the screen time report, which I'm super excited about, get time spent daily on digital media platforms, the actual types of platforms that they're using daily. Again, that will give us a more clarity on exactly the platforms that they're getting the most exposure to drug and alcohol related content on. And then also will allow us to collect the amount of negative affect typed. So basically, the app can look at the wording choices that adolescents are using and sort of categorize that based on affect being endorsed within that, to give us a sense of whether or not substance use events are related and to the amount of negative affect typed, and whether or not that's different than just those that are endorsing higher rates of symptoms like anxiety and depression, but not typing that out on digital media platforms, not letting others know through digital media that they are in fact experiencing those symptoms. And then there'll be an exit interview where we'll also do the active surveys. I found that is also helpful just because, again, adherence is always an issue with these studies. So potential pitfalls, there's still a lot of things that we have to figure out in terms of digital phenotyping methodology and its ability to be a exemplary research methodology with substance use disorders and substance use. I think it can provide a lot of really awesome information, especially related to digital media use. But there are some concerns, right? That like, what if, youth aren't able to report their substance use events, or they are, what if they're lying, right? Like I've been fortunate in my cross-sectional surveys to be able to waive parental consent and have them de-identified such that I have no idea who is replying to my surveys, and I can never identify them. But that's not quite possible with digital phenotyping. It's longitudinal. You want to have a way to contact youth if they have app issues and things like that. And that makes things more challenging, right? Are youth going to honestly tell me that they're using substances? Also, if youth are using substances, is that alone because they're using substances going to make it challenging such that they won't remember to go on their app and fill it out? So there's a lot that we still don't quite know yet about how this will actually work in real time. And then I've also talked a lot about ethical quagmires in general related to digital phenotyping at a few other conferences, but I think it's particularly an area of potential conflict in substance use research, right? Because we're asking parents to consent to their child engaging in research that would be able to capture in real time them engaging in some pretty high risk, potentially life-threatening, as I've talked about, events without me watching and monitoring that data and then reporting that back to the parents. And so that's, something again to kind of consider in terms of recruitment and in terms of just potential ethical issues that can occur with using this research methodology. And at least with some of this, I am now processing also some app-based EMA pilot data that looks at substance use as well as exposure to drug-related content online that should at least be able to answer some of these questions as it pertains to whether or not youth report about substance use events and whether or not it's feasible for to expect a bunch of teenagers to tell me about their substance use on a daily basis through an app. So that all has kind of, TBD, to be determined. So that is it. Thank you all for attending.